Eczema, a new medication decreases symptoms in babies and children by 75%. Eczema is an inflammatory skin disorder that affects between 15 and 20% of children worldwide. Children with eczema, also called atopic dermatitis, have been shown to have greater rates of mental health problems including sadness and anxiety because of the symptoms of their condition. They may also have trouble dropping out at night. Dupilumab, when combined with a topical corticosteroid, improved eczema symptoms in children 6 months to 5 years old by at least 75%, according to a Phase 3 clinical study just published in The Lancet. The inflammatory response, specific triggers, family history, and even stress can all play a role in the development of atopic dermatitis, an inflammatory skin condition with long-term effects. Eczema symptoms include itchy, red, irritated skin blisters/sores that readily burst and leak fluid, dry, flaky, and or cracked skin on the neck, wrists, ankles, or behind the elbows and knees in youngsters. Although a solution has not been discovered for atopic dermatitis, doctors are able to treat flare-ups and help patients avoid further episodes by teaching them how to take care of their skin. Common treatments for eczema include topical corticosteroid balms, drugs that inhibit the immune system, antihistamines/antibiotics. Disease of the skin that occurs in children with atopy. Kids have a higher incidence of eczema than adults do. 60% of children show signs of eczema for the first time within the first year of their lives, and while some children eventually outgrow the condition, most do not. Dr. Amy Espeller, Chair of Dermatology and Professor of Pediatrics at Northwestern University Feinberg School of Medicine in Illinois and a principal investigator of the Phase 3 clinical trial, explained that babies and young children with uncontrolled atopic dermatitis may be constantly scratching, irritable, and awake multiple times in the night with their parents, negatively affecting the quality of life for both the children and their parents. Pala claims that prior to the FDA's June 2022 approval of Dupixent for the treatment of moderate to severe atopic dermatitis in children aged 6 months to 5 years old, there was a lack of effective treatment choices for babies and young children with the condition. The therapy choices for patients between the ages of 6 months and 5 years were primarily restricted to topical steroids. According to her, pediatric dermatologists were cautious to go beyond topical steroids since, otherwise, the only other alternatives were immune suppressants like oral steroids, cyclosporin, and methotrexate. I'm concerned that some of these kids with moderate to severe eczema may need to take powerful steroids on a long-term basis in order to get it under control. What kind of drug is Dupilumab? Regeneron Pharmaceuticals Incorporated and Sanofi collaborated to develop the drug Dupilumab, which is sold under the brand name Dupixent. In March 2017, Dupixent became the first drug to get FDA approval specifically for the treatment of adult atopic dermatitis. In 2020, the FDA approved Dupixent for use by children ages 6 to 11 years old, and this year, it was approved for use by children ages 6 months to 5 years old. According to Pella, Dupilumab is a biologic drug that helps treat atopic dermatitis by reducing the inflammatory response to type 2 inflammation. Dupilumab, she clarified, is neither an immunosuppressant nor a steroid. She added that many parents and caregivers of infants and young children with moderate to severe atopic dermatitis have tried various topical medications without success. Others have attempted systemic steroids or broad immunosuppressants. While corticosteroids and off-label immunosuppressants may provide short-term relief, they also carry the risk of serious adverse effects if used regularly. Anti-inflammatory effects of Dupilumab in infants and toddlers. Dupilumab's effectiveness and safety in treating uncontrolled moderate to severe atopic dermatitis were assessed in a Phase 3 clinical research including 162 children between the ages of 6 months and 5 years. Participants in the research were randomly assigned to receive either an injectable dosage of the medicine every 4 weeks or a placebo in combination with a low-potency topical corticosteroid. Moreover, half of the people given Dupilumab had a 75% reduction in their eczema area and severity index scores after 16 weeks of therapy. EASI-75. The EASI-75 is used by doctors to quantify the extent and spread of inflammation throughout the body. After 16 weeks, 28% of those who were given Dupilumab reported having clear or almost clear skin, and 48% reported a decrease in itching. Pala remarked that the findings demonstrated that the effect of Dupilumab for most of these younger children is striking and at least as effective as what we've observed with the riskier immunosuppressant drugs. Importantly, despite the fact that Dupilumab is an every 4-week injection, there really is a big safety benefit, and the children do not need the regular blood draws to check the safety necessary for other treatments. In fact, no blood draws are needed with Dupilumab. Anti-inflammatory effects of Dupilumab in infants and toddlers. Safety data were consistent with those reported for individuals aged 6 and up taking Dupilumab to treat atopic dermatitis. Among the children who took part in the clinical trial using Dupilumab, these were the most frequently reported side effects: herpes virus infection, 6%. 5% of the population suffers from conjunctivitis, or pink eye. Tooth decay or dental cavities, medically referred to as dental caries, 5%. Molluscum contagiosum, 5%. Rhinorrhea, 5%. Pala observed that Dupilumab had a good safety profile across a range of age groups, including studies in children lasting up to a year. Generally, the safety outcomes from the study and an open-label extension trial lasting a year in children aged 6 months to 5 years were consistent with the established safety profile of Dupilumab in patients 6 years and above. These include injection site responses, which were not observed in comparison to placebo in trials including children aged 6 months to 5 years, and increased eye redness or conjunctivitis, which occurred in a small percentage of children but may be treated with medicine. Absolutely fascinating information. Professor and system head of the Department of Dermatology at Mount Sinai's Icahn School of Medicine in New York, Dr. Emma Gutman-Yaski, has commented on the results of these clinical trials. She remarked, "This is really promising information, as we have lacked both safe and effective medications for our atopic dermatitis patients until now. Unlike previously utilized immune suppressants, Dupilumab is safe for long-term use since it is a particular immune modulator," the authors write. Gutman-Yaski said, "It is vital to educate parents about the likelihood of conjunctivitis/dry eye condition, but generally the safety profile was quite good." In response to a question concerning the safety profile of Dupilumab, while discussing Dupilumab, Gutman-Yaski also highlighted the need for more study. Minimally invasive biomarker techniques, such tape strips, that we have shown in infants and children should be used in such research to provide light on etiology, she added. Many thanks for watching, guys, and don't forget to subscribe to my channel for more interesting medical videos with the newest researches on the medical market.